Ready? Great. Welcome, everybody. If we can start the Health and Human Services meeting this month. If we could start with approval of the February 10th minutes, that would be great. Someone motion to approve those.
I'll motion, Christina.
Yeah, second.
All right. All in favor?
Aye.
Great. Okay. You see we have one appointment on the agenda tonight, and that's for the OFA Advisory Board. Betsy Donald from Moravia. I get a motion for her appointment to the Office for the Aging Advisory.
Move it. Nightingale.
Okay, second.
Second.
All right, great. All right, all in favor? Great, and that's great. You'll see tonight we have 15 resolutions on the agenda. There are 2 resolutions for Office for the Aging. There are 4 Health Department resolutions. Kathleen Cuddy won't be here tonight. Nancy Purdy is here in her place. And there are 9 resolutions from the Department of Social Services. There was a mental health resolution, but that was pulled ahead of the meeting for further information. But if we, even though there's no mental health resolution, Lauren wants to talk about anything on her report, and she can do that, and we can move on, and she can move on as well.
Okay, sounds good. Okay, so I thought this was a good opportunity just to give a good overview of what we do at the mental health department, just so that everybody's aware of that. So we have 41 full-time staff there, which includes 15 full-time therapists and 3 full-time nurse practitioners, 1 full-time psychiatrist. There are some contract workers as well, therapists and doctors that we contract with that also provide those services. Our current census is 2,000. So we have 2,000 patients at mental health. Some people come there for just medications, and then all the others would be there for therapy clients. So there's about 660 or so just medication only clients that come there. The rest are all therapy clients. We are an open access clinic, which means we do not have any wait lists for services. That is definitely not something that happens across the board at all clinics. There are sometimes very giant wait lists to get in for any services, especially psychiatry. We do have a little bit of a wait to get an appointment with a psychiatrist, but to open up your case, you can walk in any day of the week from 8:30 to 3:30 to be seen and have your case opened, which definitely doesn't happen everywhere. So we're pretty proud of that we do not have a wait list for services. We provide individual therapy, family therapy, couples, counseling, case management. We do have 2 case managers that are our employees of the county. We also do referrals for other case management services. We provide group therapy as well. We have been able to train all of our therapists in dialectical behavior therapy, which is very hard to get into elsewhere. There's a long waiting list for that as well. And 4 of our newest therapists will be able to get that training. And then basically everybody's had an opportunity, and almost every therapist is trained, which is awesome. Because there are big wait lists when you go elsewhere, Syracuse and other places for that. And if anybody has any further questions about that, I can kind of explain what that is. But we do adolescent groups. Yes.
How do you get your therapist trained, certified?
So we've done that. We've been able to do that with grant money that we've gotten from different sources over the years. So we've done it in different phases. We were able to train some people in person. Some people have done some online training intensively, but the same certification across the board. So we've done that from different funding from grants. So we provide adolescent groups, and you do not have to be an open client with us. So we get referral sources from schools through FAST, if you've heard of FAST, which is, the single point of access for kids children's services, and also school districts. And they could be open to another clinic and still come to our group, our skills group, which is pretty awesome as well. And just to get an idea, like on a monthly average, we have about 135 new admissions that occur. We do obviously do discharges as well, but we also provide crisis services, so anybody can walk in any day of the week. We do have some agreements with the school districts if they have people who express, any risky behavior that they bring them into the clinic to be assessed, and we can do it that way with the school districts as well. So people walk in all the time or can call, and we can provide them with crisis services as well throughout the day.
Any questions on any of that? I just want to give a good
Just,
overview.
I was just my own curiosity of what your payer mix is. Are you mostly Medicare, Medicaid?
Oh, we are
Party?
mostly Medicaid. I would say about 80% of our clients are Medicaid.
Okay.
We do take all insurances though, by the way. We don't turn anything away for services.
And Lauren had shared with me, and I'll share it with everyone if I haven't. There was a lot of questions about crisis billable services and what rate that you could actually get reimbursed if you did crisis in the community, and there are Medicaid rates for all of that as well. And not every provider, every Article 31 is authorized to bill for crisis services, but you guys are.
Right, especially for children's services, children crisis services. So it's just us that we've been deemed able to do that, and then Liberty Resources who does our mobile crisis after hours. Yes.
Any other questions for Lauren about the mental health operation itself? We thought it was a good idea because at a meeting I said, well, I thought you had 80 staff. She's like, no. So I'm like, oh, all right, I must have made that up. But thank you.
I can testify to the effectiveness with a very recent example. I had somehow a constituent issue land in my lap, and I was willing to meet with her, and it just sort of, when everything was pulled away, it looked like it was a mental health issue. She was too afraid. She didn't have any advocates, too afraid to approach mental health on her own. So I told her I would meet her, we'd have coffee, and I'd take her up and we'd find out in person what the process was. This is exactly how you described it. Walking in, she went straight to the window. She was told that anytime, Monday through Friday, 8:30 to 3:30. And she asked what kind of insurance. She was advocating for her son, actually, who's homeless currently in our county, and who has no insurance, and settled her nerves as a mother. She was advocating as a mother, had come all the way up from Georgia to do this when she realized her son was in trouble and it ended up homeless. And it was such a smooth process. She was so delighted. And then the next day she went to pick up her son I think he was out at like Eli's, south of Wheatport, and followed that process. And I don't know, but I mean, they settled her in that when she said my son does not have insurance. It's okay. We'll figure that out too.
We'll get it, or we'll figure it out.
And he was in the next day. That just happened this week. So it's just as orderly as you described.
Very good to hear that. Yes. Any other questions on that?
I have a
Yeah.
question.
Yes.
I was on a call earlier today with a bunch of community partners and talking about wellness. Mental health was part of the discussion about the rising needs across the county, and especially during COVID. And I was just wondering what you're seeing. Also, what kind of needs assessments do you do in-house related to mental health needs across the county? Do we have any data?
I'm sure we do. I know, especially for children, we have probably a lot of data that we could, because I know they did some service mapping and kind of figuring out needs assessment as far as where the gaps are in the system. So yeah, but I could definitely get that information to you.
Is it part of your CSB planning
It's that
process
usually
or outside of it?
That a little bit outside of that, like that's happened with like with FAST. They've done a lot of work to kind of figure out where the gaps are in services and where we can help create, bring those gaps together. So yeah, I could get that for you.
Awesome, thanks.
Would there be a way to, sorry.
Yeah.
Oh, no, I'm sorry. You got the hate. Sorry. This is bad part of this.
Would there be a way to compare the current numbers to pre-COVID? And I have some follow-up questions after you're done with your presentation.
Okay, yeah, we can easily do that. Our EMR really allows us to pull those numbers as far as what we were seeing prior to now. I would say just off the top of my head, we are definitely seeing a lot more children than we were before.
And why do you think that is?
I mean, I think that COVID had played a big role in that, and the kids being out of school, and then the impact of them, being out and transitioning back. I think that was really difficult for a lot of kids in the community.
And do you foresee that there will be more of that?
Yeah, I mean, I can't answer that fully, but
Right.
we would anticipate that it would, continue the way that it has. I think there's just a huge need for it, so. Okay, and then I know Monica put together a Healings Community Study update that I know I believe everybody's had an opportunity to get and read. So I was just curious if anybody had any questions about that really awesome work that they've been able to do with that grant as it kind of comes to somewhat of a close in the implementation period. So I was just curious about the update.
The closing timeframe is June 2022.
Yes, yes. And I believe they'll be losing part of their staff funding in September, and then hopefully they would be able to continue with the other two until beginning of next year. But our goal really is to hopefully continue that work and try to figure out a way to just sustain that, to be able to continue all the awesome work that they've been able to do with the grant.
And also Monica for the, I received in the mail.
Oh, I was just gonna say that.
The stigma.
So everyone should have got this in the mail, right?
Yeah.
I thought it was pretty awesome.
It's
Yeah.
a compelling piece. It was easy to sit down and read. It was interesting.
And she really, people have been calling and saying how awesome it was. So it's, you get things in the mail and you just, I don't know, depends on what it is. You might just get it and toss it. But a lot of people have read it and called and said how awesome it was to get that in the mail. And that's even triggered, I think at least 25 people have requested Narcan kits from just receiving this in the mail alone, which I think is just great. Yeah. I just wanted to make sure everybody got that. Yes.
I have a lot of language to change.
I know you don't think about it.
Right.
So it takes a lot of mindfulness to be able to change some of the words that we've been using for so long.
Right.
And then the last piece is just kind of just as a reminder, we do have an ARPA proposal in for mobile crisis expansion, which definitely is a huge need to expand to daytime hours. So just as a reminder, just letting you all know that is out there, and we would like to get that started as soon as we can because of this. We know how much of an impact it has on law enforcement and just the community overall, and how many people that can really help. So just wanted to throw that out there as another reminder. And those are my updates. If anybody has any other questions?
I'm sorry.
No, after you.
The point of clarification on crisis respite is, it is the expansion. It's not the night, but it's during the day. Currently, there is no mobile response to crises during the day in the city or the county.
None.
And if this particular initiative takes off, this will impact law enforcement, both city and county sheriff's department, and you will eventually allow for the respite team to be called upon by the community. The schools, if they have a crisis during the day, can call directly and not involve law enforcement. I mean, that's your overall goal, is really
Yes.
to make it, to really expand this capacity throughout the daytime system.
Yeah, and I think another piece of it is to, it's ER diversion too. If people don't need to be going to the ER, and we can offer them other services or make referrals to other places, to mental health or other agencies for treatment, then that's what we want to be able to do. Respond to that during the day, just like just like they are able to do at night. It's really a benefit for law enforcement. Because a lot of calls, I could say I did mobile crisis for a long time. You can easily know in the first 5 minutes, usually I'm telling the police, you can go, you don't have to stay. So it's really helpful for their time, and they can do other things with that.
Great, thanks.
Yeah. Thank you. I did see the ARPA request for mobile crisis. What I didn't see was any ARPA request for any of the mental health issues that we talked about, any intervention that you have to do for the children and the youth as a result of what they faced during COVID. Is it because you have adequate grant funding available from the state, or why do we not have to put in an ARPA ask for that?
I think I can say I think we do a very good job of responding. We have the resources in our clinic, and we've been able to train people in some of these modalities with grant funding. So we've been able to use that to do that. So we felt like mobile crisis was a priority as far as expanding that and be able to respond outside of just our clinic, but to be able to provide those services countywide during the day.
And just the fact that both the Department of Social Services and the Mental Health Department have the ability to link kids into multi-systemic therapy, functional family therapy. Those are the resources that are already existing. We just got to make sure that people who need it get linked.
Yeah, so through FAST especially, kids are being referred to FAST through school districts and all of the agencies to be able to get community-based services that we already have contracts with to provide.
But to Lydia's point, you don't have waiting lists for those at this point, or you?
I would have to check. There are some waiting lists for those services, yes.
Thank you.
Any other questions?
So waiting list for things like the referrals to functional family therapy or, okay, so the referrals outside of your clinic.
Yes.
Okay.
Yes.
Thank you.
Thank you.
Brenda. If you'd like, why don't you go through your two resolutions first? Sure.
So the first resolution is actually for a new program that we're implementing. As soon as I report, and I've been talking about the shortage of aides and how we just cannot get aides in the homes because of the aide shortage to help give respite to our caregivers and to provide needed hands-on assistance for those who are trying to live independently. This particular resolution is targeted for our caregivers. It is mostly online, really unique, really easy to use program that when it supplements the caregiver services and support that we already provide, gives us another option for individuals to utilize. It's a contract with a evidence-based program that is available to anyone. Once we sign the contract, they give us access to anyone in Cayuga County. There's no limit on the number of people who can access this program. And it's targeted with caregiver support features such as education pieces, information pieces, video, instruction on various tasks, stress relief components. There's just a whole variety. And it's one of the easiest to use websites I've ever seen. It's very in depth. If you want to go in depth, it's very superficial. If you want to stay superficial, most of the options start with a 3 to 5 minute time period, and you can come back, you can dig deeper. It's just a really nice option for our caregivers. Concern is always, what do we do for folks that don't have internet? We still are trying to make available to those who need it, some laptops, some internet service when we can, but this also has a print option. So for those who can't access the internet, we can help them access the same material, and we can mail it or send it to them, get it to them. So this is a 1-year contract. There is a possibility at some point that this may be something that our state Office for the Aging either find some funding for or supports in some other way. But for us right now, we're moving ahead with it. We'd like to move ahead with our unmet need funding. Because that's really the whole point of the unmet need funding. We know there's an aid shortage. We're trying to find other ways to help meet those needs out there. Any questions?
Great. Let's get a motion for HH1. Yes, so we get a motion in a second. In a second? Okay, sure, Lydia, go ahead. Thank you.
I think that you answered my question, but I just wanted to make sure, will the 159.47 result in unspent budget, or will that just be applied to unmet needs?
In the end, it's part of the unmet need funding.
And
Not an easy answer, but yes.
Right. So you won't see an unanticipated unspent budget.
That's my goal.
funds. Thank you.
Any other questions about this? Using this 15,000 for this purpose? Go ahead.
But I just wanted to, it's 15,000 out of the total fund.
Yes.
Okay.
Yes, and that was what we actually had. When we got the unmet need money, we weren't exactly sure what we were going to use it for. We had a very short time window to spend this money. And so this is actually coming out of the funding that has to be spent by the end of this month. So it was just the kind of the perfect amount, even as it turned out, that we had sort of allocated towards the contracts.
Thank you.
Okay, all in favor?
Bye.
Any opposed? Okay. Great. HH2 is asking for $1 increase in the PCA rate after they initially signed the contract.
So I always do contract negotiations, October, November, December. There's, for our aid service, we are open to vendors, various vendors, because none of them can totally fully meet our needs. This is one of our largest providers of aid service. And after we had negotiated the contract, they came back to us and said, due to the kind of unforeseen expenses related to COVID, related to wages, related to shortages, that we need to raise the rate by $1 an hour. They are our biggest provider. We don't really have a lot of choices. Currently, we do have the funding because we can't find enough aides to pay anyway. So this company asking for more is a way to at least maintain this service level that we have.
Without it, likely they wouldn't entertain the contract and you'd have a bigger issue.
Wayne and Seneca County already agreed to this price.
Okay.
So, yeah.
All right. Can we get a motion for HH2 authorizing the increase by $1? And I think you're working with the county attorney's office to just amend the current agreement and move that forward.
Clark, I'll move it.
Second,
I'll move it.
thank you. All in favor?
You're welcome.
Okay. Oh, I'm sorry. You just gotta say, hey.
Do you mind telling me where the additional, what account the additional funding will be coming from?
Same account.
Same one, thank you.
So we have multiple contracts and we never expend all the funds right now because of the aid shortage.
So you have like 300 and some odd $1,000 of ISEP money that you can't spend because you don't have enough aides, and that's where it's coming from.
That's good to know. Thank you.
All right. Any other questions for Brenda or anything you want to?
We need to vote on.
Brenda, how many
Oh,
hours?
yes.
To vote on that
We
one.
have to vote. Can we vote on
Yep.
H2? All in favor?
Aye.
Okay.
Aye.
And opposed. All right.
I just related to HH2. I wondered how many hours do we purchase from them usually in a contract year?
Can't answer that off the top of my head. I'm sorry. I can just tell you they're our largest provider by far.
Okay.
They're the most reliable provider by far. They're the ones when we ask multiple agencies, can you fill this? They're the ones that fill it. So, yeah, but I can't answer that. I could get it for you if you'd like.
No, that suffices.
Can I just talk about these couple things from my
Sure can.
report? Okay, I just want to mention, Chris and I talked today that we don't have an update from the Boyle Center attorney yet. We're anticipating they're going to have a board meeting next week. So hopefully we'll hear something more regarding that space proposal for the first floor at the Boyle Center. The home health aid shortage, this was just to summarize all the different things we've been doing over the last few months. I've been bringing multiple resolutions. This was just to summarize the multiple different ways we're trying to address the aid shortage and using that unmet need money. But the third thing I wanted to mention is that with the addition of a new staff person that started late in the fall, with some of our additional funding that has come in, and with the new technology as a result of COVID that we now have access, because the little office for the aging, we never had cell phones, we never had technology where we could go out in the field. We now do. The staff are very, very well versed with it. We've certainly been operating remotely all that time prior. Now we're going to take that equipment, and the staffing is such that we can go out in the community. We've been wanting to do this for 5 to 10 years, and we haven't. We get so much demand for assistance in phone calls and people coming in. We had not been able to go out in the community. Now we can do that because of the technology. And because of the staffing. So I kind of wanted to let you all know that's one of the positives that has come out of COVID and out of basically investing in our tools and our workforce is now we can get. So we're going to be out in Moravia on March 30th at the town hall. I got an invitation from, some of you remember Terry Baxter. He came in person, said, we just bought this building, renovated it, added on to it. It's got internet and it's got room for community providers to come in. And so we signed up for that. We're going to go out there. And then we're in Sterling on March 24th. Lisa Cook, Lisa, town clerk in Sterling. She's also been asking us to come up for years. They've been very eager to have us come up. So perhaps this will start something that other other county departments, if they're able to or need to do outreach, this might be something that others are able to do eventually too.
And screen for program eligibility. People who want to talk to the OFA representative could come. do it
Well, we're
right in
always
their
going to
community.
send a
Great.
Medicare health insurance specialist and then a New York Connects who can answer pretty much anything. Yeah.
If I have folks in the towns that I represent, if we're interested in that community outreach, should they reach out to you specifically?
They can, so these options are available on a call list. We can set up an appointment or logged in. We'll do either, and I can send you the actual information. It's 10 to 1 on those 2 days.
You're setting it up in her community.
At this point, I don't see us being able to quite expand that way. This is a big deal for us just to be able to get out on a regular basis.
Yeah.
In the
And I was
community.
excited.
I think it could happen eventually, just not quite ready yet.
Okay.
Wow. Yeah, we're trying to, it's just our long county that the folks north and south are constantly telling us that they don't have access to us the way others do. So trying to start there.
That's great. Thank you.
All right, great. Thank you.
Thank you.
Okay. I was just looking at it. You released. That was very nice of you.
I didn't
just
want to
looked-
interrupt
Oh, it's a
anybody.
cookie. Okay, if we could go on to the 4 health department resolutions. I did talk with Kathleen and Nancy at the special board of health meeting, and maybe I'll go down these 4 resolutions. Nancy has additional information if we move them as a group and there's questions. But for the sake of time, I'll say the HH3 is to allow the public health director to renew a contract they have with Cayuga Medical Associates, and this contract's been in force for a number of years. It's a resource when a tuberculosis case is identified in the community and the health department needs to get consulting services and some care for that patient. I was told that it's limited at no more than $500 a month for a consult. Nancy has some information about what the health department has paid on that contract over the last few years. And if I'm not mistaken, there have not been any new TB cases in the last few years, and there hasn't been anything extended, but this is a contract that you need if you end up having a TB patient show up and surface.
Yes.
Let me go through the rest and then
Okay.
HH4 is to allow to fill 1 supervising nutritionist in the WIC program. That is 100% funded by the WIC grant and budgeted. 3, HH5 is to authorize the chairman and the public health director to enter into agreements in addition for transportation of preschool children that fall outside the busing route that's been bid. And the resolution says it quite well that this will allow, if this passes, the public health director to be authorized to renew a contract. I'm sorry, wrong resolution. The public health director is hereby authorized to enter into an agreement with available transportation providers on an as-needed basis for specific specialized routes in amounts not to exceed 1.5 times the rate charge under the primary transportation contract. So it was very difficult to identify who the vendors will be, how much they will be paid, because it's case specific.
Right.
And this was the best way that the Kathleen and the county attorney felt it was appropriate to move this. And lastly, HH6 is to allow the health department to purchase 1 car, which was put in their 2022 budget. So if we could move together HH 3, 4, 5, 6.
I have a question.
And then we'll ask questions on any one of them.
Okay, great. Thank you.
Can I get a motion for those resolutions?
To bundle HH3, 4, 5, and 6.
Okay, and second?
I'll second
Okay, now we can open questions for any of them. Yep.
HH3, this is the tuberculosis consultations. Are we paying $500 a month whether or not we utilize those services?
No, that is for 2020 and 2021. We had no cases. 500 is the max.
They can bill us each month.
Yes, that they can bill us. We had no cases, so we paid no dollars.
So we paid zero.
And we seek them because they're an infectious disease physician. That's why we have the meeting.
Questions? Four, go ahead.
For HH4, the position is 100% federally funded, and there is an ask for any fill behind that may occur. Is the fill behind, do you foresee that as being required, and will the backfill also be 100% federally funded?
It will be 100% federally funded,
For the
but
backfill,
yes,
thank you.
I'm under the impression all WIC staff
yes,
costs are covered by the WIC grant.
that's correct.
Okay.
That's correct.
You don't know if you'll promote from within, so,
That's right.
right.
Okay, that's still open.
Yes.
Thank you. There's one more on 5, if I may.
Okay, sure thing.
This is with regard to the transportation of preschool children. Is there any anticipated change in the budget based on this?
Boy, I don't know the answer to that. Since it's,
Yeah,
Yes.
my understanding is there's a huge dollar amount in the transportation line. So they have projected what their transportation costs would be. There's no ask to have money come from any other source to cover this, but to your point, we don't know how many
we don't
children.
have an absolute, we have rates. We have rates of what the rates are and what this contract is built on. But I can't promise that.
I would think that you had budgeted to cover what you anticipate your cost to be, which is.
Absolutely.
And if there was going to be an overspend, then at that time, we would have to pass resolution for that, correct?
To come back and ask to put money in the account. Yeah.
Excellent, thank you.
Thanks.
Another question, Lee.
Yep, sure.
Yes, on HH5, preschool children, is that to a school function or to preschool, or what is the
To preschool.
to preschool?
To a state education approved preschool for kids with disabilities,
Mhm.
not a regular preschool. These would be kids who are evaluated, need to go to the Gaver Center or one of the state
Yes.
education approved 3 to 5 programs for children with special needs.
Okay. And well, I know a lot of these, well, at the age, I guess is the difference. You said 3 to 5, it's preschool.
Yep.
Okay.
It's weird because the school district authorizes the services through the CSE process or the CPSE process. But in this case, the counties pay for the cost of education of the education of physically handicapped children. So we are the payers of these services,
Yeah, it just,
transportation and school.
it seems a little funny because the county will transport a student across the county to go to a school
Mhm.
that handles the special needs required.
Yep.
But the county has to transport preschool. You know what I mean? And there's a lot of preschool programs out there at schools.
When I talked to Kathleen about how often is this happening, that these transportations are happening outside of the current bid she has with the busing company, she said there are certain subsets of schools outside of Cayuga County that specialize for hearing impaired or,
Yeah,
yeah,
yeah.
and those are the types of arrangements that have to be made and transportation has to be paid for.
yeah, that's fine. I had questions. I don't have a problem with it. I have more problem with the child being picked up that's a quarter mile from school. Personally, from a person who used to walk.
Oh,
Thank you.
any other questions? No, great. We have motion and a second. for
We
the
do.
bundle. All in favor?
Aye.
Any opposed? Great, thanks, Nancy.
Thank you.
Thank you, Nancy.
Thank you.
Thank you.
Christine, last but not least. You don't have so many resolutions.
I know, and I think I told you last month that I wouldn't have this many, and I think I have many or more.
I was looking at the agenda and maybe if you could go over 7, 8, 9 and sort of fit together with contracts. And then I'll get a motion for them and then we can open it up for questions. I'll start that way.
Okay, so HH7 is for the enter into a contract with Booker T. Washington for $43,000. We were able to get an allocation from the state for that amount of money to develop and implement a program that is to help address the needs of the commercially sexually exploited children and trafficked and at-risk youth. So for the first time this year, the department is actually getting this funding from the state for the safe harbor. Last year, the money was through the Youth Bureau.
That's what Lloyd was saying.
Yep.
It'll be-
So for 2022, the money transitioned to the department and all of the counties in the state. And so Booker T. Washington was the contract that Youth Bureau had last year. We are asking to continue the contract with them for 2022. We actually submitted a plan that was approved. So now I'm coming here to ask for us to accept the funds and to enter into the contract with them for this year.
All right, want to go to 8 and 9?
HH8 is also for a contract with Booker T. Washington. They provide a summer day camp, daytime program for youth in the summer months of July and August. And this is a contract that we've had with them in the past. We're going back to asking for the funding, permission to give them $15,000 to use towards camperships for the children there that are TANF eligible. Last year it was $7,500. They're going back up to the previous amount of camp that they're offering here with things being better as far as the COVID situation.
And that's 100% funded too.
That's 100% funded through TANF, yes.
Okay.
It is a renewal of a contract, but for the back to the previous amount. HH9 is for us to enter into a contract, a renewal contract with CAP for the provision of non-residential domestic violence services. We're required to provide these services to the people of Cayuga County. And it's for a one-year term for $120,000.
Someone given a motion for HH7, 8, and 9.
Marco, I move to bundle 7, 8, and 9.
Second.
Yeah, second.
Okay, any questions about COVID?
On HH8, with regard to entering into a contract for the TANF eligible recipients. Eligible recipients is 100% reimbursed now. Is that expected to go in and out of the budget wherever it comes from within the same year?
Yeah.
If it is not reimbursed, where does it come from? Does it come out of your budget?
Well, we would only be giving them money for TANF eligible youth that go there. So anybody that receives this funding would be TANF eligible.
So reimbursement is guaranteed.
Yes.
TANF is reimbursed state and federal, no county.
Thank you.
Yep. Okay,
Question.
yep, go ahead.
Hi. Can you just talk a little more about the BTW contract for the child sex trafficking,
Safe harbor.
exploitation? What kind of services are they providing? And I guess, how big of an issue is this for our county?
So the safe harbor money that we were given, the allocation comes with a list of things that you're able to, implement within your plan. So the plan that Lloyd through Youth Bureau had set up was really around community awareness, helping the community become aware of, what does it really mean to be a commercially exploited, youth? What does sex trafficking look like? Because there are some definite misconceptions around that is our feeling that, there's other ways that children are sexually exploited, in the community that aren't like the things that you see on the media where, children are, kidnapped and taken and sequestered away from folks. It can be things that are more, that look a little bit more like a child that doesn't have a place to stay and they're going to someone's home. Somebody says, oh, you can sleep on my couch, but in turn for doing that, there might be some exchange of, services, they're giving them, sometimes it's like drugs, if you do this for me, I'll do this for you. That's also considered exploiting children. And So making sure that people are aware of the signs to look for, questions to ask children at schools. So part of the plan that we have with Booker T. Washington is community awareness. Going out to the schools and talking to folks about, about this topic, law enforcement training, some information that can be shared as far as like pamphlets and things to give out to folks. And it also is part of the money is for anybody that calls, and on the brochures, there's a number to call. They would answer the call. They would be able to help folks get to the right place to get help and seek services if they know someone that's being exploited or they themselves are being exploited. So it's not a ton of money. It's $43,000, but focusing on that community awareness, I think, is something that we still need to do. I think, when you ask people, they say, oh, that doesn't happen here. That happens in the bigger cities, and that's not happening in Cayuga County. There are things that happen here that do fall under that umbrella of, exploitation, for sure. Does that answer your question?
Yeah, it does. I was just wondering how much of an issue is it, or what, I don't know if it's even possible to track. But
So in the Department of Social Services and Child Welfare, one of the screening tools that we have to do on all of our cases is around sexual exploitation. And there's questions that we have to ask about, like, risk factors and about experiences that children have, things that we know about their family situation, risk factors like being homeless, having, a substance abuse issue. And there are children that screen as very high risk and also have had experiences that do speak to being exploited. I don't have specific numbers for you. I mean, I might be able to get something like that that's a little more detailed and bring it back here like next month. As far as the frequency of those open services cases, not like community wide so much, but like what we have here, the cases that we have open.
you don't have to dig for numbers. I was just curious, and it sounds like you see this through your department.
Mhm.
So I'm glad that we have this contract in place. I didn't realize exactly that we did this outreach, so it's good.
Any other questions? Go ahead. Have you seen an uptick in activities such as this during the COVID? If it's hard to tell, then.
Yeah, I guess I wouldn't be able to say that, yes, that we've seen an uptick in this. I think it's been pretty consistent.
Uptick in other needs, potentially.
Uptick in other things, but not specifically this.
Okay, we have a motion and a second. All in favor?
Aye.
Any opposed? Okay. Christine, HH 10, 11, and 12, and HH 10, obviously, these are 3 requests to fill budgeted vacancies. Caseworker, you're asking in 11 to fill the deputy director, which is the position vacated.
Yes.
And you're also asking to fill a senior account clerk in the accounting unit.
Yes.
Move to bundle.
Great. Second,
Lydia.
Warco, second.
okay. Any questions about filling these vacancies? No? All in favor?
Aye.
Great. And then 13, 14, and 15, if you want to go through those, they're contracts and vehicle purchases, so.
So 13 is we're asking to contract with ABC Cayuga for services at Play Space. They this is a contract that we already have with them. So they have a membership fee for folks to be able to go to the program there and utilize it year long whenever they're open, whenever they want to come in. And so for families that are have the income threshold of being below 200% of poverty.
And that's TANF, and that's where there's full state and federal.
Full state and federal. So we're asking to be able to support, providing those memberships for families that come in that fill out an application and are at that threshold of income.
At this point, you're not limiting any of this, it seems like,
We're
because
not limiting it. I think, we think it's a good service for folks to be able to bring in the younger children. They being able to go there and play with those developmentally appropriate toys and, interact with the staff there. I think it's, we have had great feedback from folks around the benefit to that, and we would like to continue that. Is to purchase 3 vehicles for DSS. We have some older vehicles that are probably 6 or 7 years old that we have driven a lot, and we'd like to get 3 new ones. $65,000 is the ask on that, and that's in our budget.
15.
To renew a contract with Rescue Mission for their family and transitional housing program. This is a renewal, the same amount of money that it was actually last year. This contract hasn't gone up in a long time. This helps to provide the spots for the folks that are there. I think it's 8 units there that folks move into when they're homeless, stay for a period of about 90 days, receive case management services, and hopefully, move on to permanent housing. That's been kind of a challenge because of, the lack of affordable housing that is out there. So some of the folks have actually moved into transitional and had to go back into other emergency housing, but the supports that they get while they're there and the connections they make with trying to, locate housing is, I think, very, very helpful.
Move to bundle, Lydia. Okay, Lydia wants to bundle those, and we'll get a second. And if you have a question, second for.
To
Okay.
bundle.
Yep. All right, Trish.
I did have a question. You said that there were some folks that were in transitional and then they went back to emergency. Is that because the time frame for transitional?
Yeah. So that's once they time out of the length of time that they can be there, the 90 days. They can't stay past the 90. So if they haven't found a place to go that's permanent, then we've had to, these are still in need of emergency housing. So we've had to put them in a hotel, which is unfortunately not ideal and not the way we want to do things, but we have seen that.
Any other questions about those last 3 resolutions? Okay, all in favor?
Aye.
Any opposed? All right, we have a question?
No, you keep looking at me up to oppose.
So agreeable. Right. Okay, you have anything you want to add to the?
I made some points in my summary. If anybody has any questions about that. I just wanted to say that we're back to pre-COVID building operations as far as the departments flow through the building. We've gone from, everybody stops at the front door or nobody gets in really. But except for the folks that needed to now we're back. Everyone can come through, use the badge pass system to get to where they need to go on our floors. We're utilizing the waiting room again on the 3rd floor. We have our reception window on the 3rd floor running full speed again. And I think everybody's glad to be back to that, that way of doing business.
Your housing numbers are still pretty high, emergency housing.
Our emergency housing numbers in this report were about 120. I did get a little bit of a good news yesterday where we were down to 112. So we did move some people to permanent housing. That was good. Can kind of see the light at the end of the tunnel of the executive order for housing during the cold weather changing over the next
the
few
code
weeks.
blue, you mean?
Code blue, yeah. So hopefully that will help shift our numbers a little bit. So that's.
I was curious, and maybe you don't know this. During code blue, even if a case is sanctioned, you must house them. That's why
Yes.
you can't refuse them.
Yes.
Is there quite a few people out of this 112 that are sanctioned cases?
Fair number.
A fair number. So when it's warm out, they wouldn't be in housing.
Right. I can try to bring that.
Then where do they go?
They don't get a reimbursed stay by the Department of Social Services because they're sanctioned. They haven't followed the rules. But because of code blue, the rule is if the temperature drops below 32 degrees, the local district
Must.
and the state picks up the tab or not necessarily for the sanctioned cases.
Yeah.
The state does pick up those costs. Generally, though, we pick up a lot of the program costs. But yeah, even if it's reimbursed by the state, we still have no place.
Right.
But then after code blue, you're released out into the
Yeah,
street.
and so some of those folks end up finding a place to go. So, they end up advocating for themselves and we can help advocate for them to, stay with somebody that they know. Right. So they're out there.
I'm curious, what are some of the some of the things that might happen that would cause them to be sanctioned and be asked to leave?
Not engaging in substance abuse treatment if they need to, engage in a program like that.
Job search?
What's that?
Is it job search and all of
Job
that?
search, trying to find work and become gainfully employed. Some of it is if they destroy the room that they're in, if there's, fighting, bad behavior, hotels, that's not allowed, allowing somebody in the room that they're not supposed to be allowing in the room. If, we're paying for the room to house them and they invite all their friends and, are in the room, having parties, things like that, that's not allowed. And so they can be written up for that kind of a thing. But
And that's why hoteling people that are homeless and in need of housing is not the most ideal. You want to put someone in a supervised, if you need a place to stay, you certainly need a place to stay. But the concern is some people come for that's a more attractive option than a homeless shelter. That you're understanding?
yes. And so one of the reasons that we put the system into place where anybody that calls up after hours to the to be emergency housed speaks to somebody and doesn't find out where they're going to go. So they wouldn't know when they call and they say, I need a place to stay. I don't have any place to stay tonight. And there's some screening questions that we ask them. One of the last things that we say is, okay, you need to present at Chapel House. And if they say, well, where am I going to go? We say, well, we're going to talk to you about that when you get here. Some of those people just disappear because what they're
looking for the hotel room.
More liking is the option of a hotel room versus you're going to stay at Chapel House tonight.
So if it's unsure that they might be where they're going to go, they'll say, well, maybe never mind.
Right.
Not everyone cheats, but.
Right. But we thought that would, kind of ferret out who is truly in need, because if you're truly in need of emergency housing, you're going to go to Chapel House, and you're going to be okay with that because you don't have any place else to go.
Right.
So that was one of the strategies that we put in place to try to, be more assured that, the folks that we're housing are truly in need of that. And, they are not just shopping for a place to stay that's a little bit more what they want to do, like be at a hotel. Thank you.
Would you be able to provide us some budget numbers of what we're spending on emergency housing in the hotels? I can't remember the last time we saw those numbers.
Okay, I can bring that next month.
Great.
Or I can pass it out ahead of time, so you can have it, we can talk about it, can send it through.
And to Lydia's point, break it down. If we're housing TANF eligibles, the expense to the county is nothing. If we're housing safety net assistance cases, single adults without children, expense a lot of this is, 71% of those costs are county costs.
Yeah, I'd love to see those numbers.
Yeah, thank you. Yep, and I can get the numbers on hotel expenditures and also our contracts with Chapel House for their men's shelter and also for the transitional housing through Rescue Mission. So I can get you the breakdown of what we're spending in all those areas.
Christina, what are you finding that you have enough housing for the numbers requesting it, or are you struggling on any given night to get folks into
for emergency housing?
Yeah.
We've done okay. I mean, the staff work really hard to make sure that we're keeping good relationships with, the hotels that we're utilizing and, that we're, taking care of the folks that come in during the day, trying to advocate for them to stay with, friends, family. I mean, we always try that first. So I think our numbers at the hotel really do speak to like the folks that don't have any place else to go. I can remember a few years ago, like really scrambling and not being able to like, where are we going to put these people? We have no place for them to go in the hotels. It hasn't been so much of that this year. We've had some other hotels come on board with being willing to partner with us. And I don't know if that's because some of their numbers and their folks that stayed there dropped during like the COVID time when there weren't people going. And so they sort of developed a relationship with us. And kind of came into it when they were more like, wow, like we need to do something. So let's, work with DSS. But they've stayed on with us, and we do house folks, different hotels in the county.
Has the issue at Grant Ave mostly been resolved?
resolved as far as,
Are people allowed to go there again?
no.
They will
the
not be
hotel-
utilizing them at all again?
The hotel is still condemned. The last I talked to the city, there was still a lot of work that needed to be done. I think that the owner of the hotel was working with the city and talking with them about what needed to be done, but they're not open. If to be open, my understanding is, they would have to work through the process of the city's, codes, and they would have to make sure that it's up to speed. So for now, we're not using them. If they were to reopen, we would have to, consider that, take a look at what things are. But they would have been vetted by the city code to make sure all the rooms are up to par with their heating and their electric. And
So you would have to requalify.
yes, we'd have to inspect them again and get in there and see it. And I would want to talk to the city.
We should vote on these 3 resolutions, correct?
We already voted on these.
We did.
Yep.
Okay.
You're all set. This is just ongoing.
Okay, this is just conversation. All right. Any other questions for Christine? Or anything else you want to?
One of my points on my summary was offering for anyone who would like to, visit with us and talk to us a little bit more to learn about the programs we have and the services that we offer, and whatever you're interested in learning more about. I'm open to that. Just give me a call and can set something up. We can tour you around, see our area, and help it work.
Appreciate it.
Thank you so much.
Yep.
Thank you.
Thanks, Christine.
Thank you.
Thank you very much. Good job.
Can I get a motion to adjourn?
Motion, Lydia.
Second.
No, you didn't oppose. Yeah.
Like, hell.
Record time for HHS.
Yeah.
Made up for
Very
last
efficient.
night.
Calendar.
Very
Made up for
efficient.
last night.
It's because you weren't so disagreeable.
I know. Bad rap.